Have you just found a tick on your kiddo and wondering if they could potentially have Lyme disease and what to do about it? Today's episode talks all about that and is for you.
Welcome to the BeeHive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. In today's episode, we're going to talk all about Lyme disease and tick bites. So let's dive right in. So it's summertime here in New Jersey. A lot of us are going outside and taking advantage of the good weather. It's also time for tick diseases here in New Jersey as well. Ticks typically are dormant in the wintertime, and in the warmer weather, they come out to complete their life cycle stage. New Jersey happens to be an area which is endemic for Lyme disease, so I thought that we could talk about Lyme disease today and the new updates for prophylaxis for Lyme disease and the treatment of Lyme disease. So before we start talking about Lyme disease and tick bites, I want to take a little bit of a moment to explain how Lyme disease is transmitted and why we mostly see it in the Northeast and not so much in the South or the western part of the country or the plains area. So what is Lyme disease? Lyme disease is actually a bacteria or a pathogen that causes the illness, Lyme disease, in its host, human beings. So the host is humans, the bacteria is Borrelia burgdorferi, and the vector is the tick. So what is a vector? A vector is an organism or an animal that transmits a pathogen to humans. But that does not mean that ticks or deer necessarily have Lyme disease. Actually, what happens is there is a reservoir. So the reservoir for Lyme disease is actually the white-footed mouse. They are asymptomatic carriers of Lyme disease. And what happens is a tick bites an infected mouse, and then it bites a host and transmits the disease. The type of tick that can transmit Lyme disease from white-footed mice to human beings is called a black-legged tick. The reason that we only really see Lyme disease here in New Jersey, as well as the Northeast in general, is because the white-footed mouse is actually endemic to this area. And as you travel south and west, we don't find white-footed mice, and so we don't find Lyme disease as often. The other important thing to know about Lyme disease is that it's actually only transmitted by ticks in their nymphal stage. So ticks go through three life stages. They go from larvae to nymphs to mature adults. And each stage in their life, they require a blood meal to make that transition. So a tick typically only actually takes 3 blood meals in its life, and it has a very short life cycle. The tricky part is ticks in the lymph stage are very, very small. They're about 1/4 of an inch. So for comparison, here's a ruler with a dime and the black-legged tick, and you can see how tiny it is actually compared to that dime. So they can be really hard to find on your body because they're so small. So most people who are bitten by a lymphal tick actually don't know that they have been bitten by the tick because it's so tiny it falls off. The other important thing to know is a tick needs to be attached to its host for quite some time to actually transmit Lyme disease. So they need to be attached for approximately 36 hours to transmit the disease. That's why it's so important when you go out on a hike or a wooded area where you have a high risk of being exposed to ticks that you do a tick check every day or at the end of the day, because if you catch the tick within that 1 day time frame, it's very unlikely that they would have been attached long enough to transmit Lyme disease. So now that we've talked a little bit about how ticks transmit Lyme disease, how they become infected, and how we become infected from them, and what kind of ticks can actually give us Lyme disease, let's talk a little bit about what you should do if you find a tick attached to you. So if you find a tick that is still attached to your skin, the best thing to do is actually to remove it with a tweezer. All of those old housewife remedies like putting Vaseline or oil over them, burning them with a match, can actually injure the patient more or injure yourself more, and they may actually cause the tick to become deeper embedded into the skin. So really discourage patients from trying to either suffocate the tick by putting some sort of ointment on top of it or from burning it off. You want to take a tweezer and you actually want to go as close to the skin as possible and grab the head of the tick. That's, again, if you're looking or referencing this photo, that dark, very small mouth part at the top. Most ticks when they're attached to human beings, create a proteinaceous secretion that actually cements them to the skin. So they can be quite hard to remove. So you want to take your tweezer, go as close to the mouth as possible, grab tightly and firmly. Know that when you're pulling back, you're going to have to apply some pressure to the tick, and that the skin actually might tent and follow. So you can help yourself by putting one hand on the skin near the mouth of the tick, taking the tweezer, grasping and pulling, and quick and strong. Then you want to actually examine where the tick was to make sure that you haven't missed any mouth parts or legs that are still remaining in the wound. If you have any remaining mouth parts or legs, I usually encourage patients to reach out to their healthcare provider at that point to get help removing the extra parts. Another helpful tip or trick I have for parents when they're removing ticks is actually to save the tick. So if you're not sure what kind of tick it is, you can bring in that tick into your healthcare provider, and they may be able to identify to make sure that the species is a black-legged tick and that the stage is an nymphal stage. And actually, there's many private services out there now where you can send the tick in and have the tick itself tested for Lyme disease. And the reason that this is so helpful is that if the tick tests positive, we might be able to spare that patient a longer course of antibiotic treatment for Lyme disease by knowing that the child does not, in fact, have Lyme. So 3 tips. 1, when you're out in a place where you think you're high risk for tick exposure, do a tick check every day. 2, when you're going to remove a tick, use tweezers only. And 3, once you remove the tick, put it in a Ziploc and save it. Bring it to your healthcare provider for testing. So what if you're not sure if you had a tick bite? So tick bites typically look a lot actually like mosquito bites. They just have a little dot, and it can be very hard to identify if you have not actually seen the tick on yourself or your child. So what are some of the symptoms you might be looking out for that are consistent with Lyme disease? Well, in the first 3 to 30 days after the tick bite, the most common symptom by far is a rash called erythema migrans, also known as the bullseye rash, seen nicely here. Typically, 70 to 80% of patients who have Lyme disease are going to present with this rash. So it's a pretty good screener for Lyme disease. Other symptoms in the first 3 to 30 days might include fevers, myalgias, which is muscle pains and joint pains, swollen lymph nodes, and fatigue. It is not common in the initial stage of Lyme disease for patients to have arthritis, meaning a swollen, warm, hot joint. More commonly, we see joint pain. If Lyme disease is not caught early and treated, patients can then go on to develop later signs and symptoms of Lyme disease. So typically this occurs months after the tick bite. Those include severe headaches, joint stiffness, arthritis, so swelling and pain of the joints, irregular heartbeat or heart palpitations, meaning feeling like your heart is beating irregular or quickly, a facial palsy where you have loss of tone of one side of the face, numbness, tingling, nerve pain, and dizziness. So then what do you do if you're experiencing some of these later signs and symptoms and you live in an endemic area for Lyme disease and you're not sure, could you potentially have been exposed to a tick bite several months earlier, not known? So first thing I'm going to do is encourage you, of course, to reach out to your healthcare provider. And what they may do based on your symptoms and a physical examination is blood testing for Lyme disease. So currently the CDC and the research supports blood serology, or testing your blood for antibodies, as the most accurate, the most sensitive and specific test for diagnosing Lyme disease. There is a blood PCR test available for this bacteria, but it's actually not as sensitive or predictive of Lyme disease as the blood serology or antibodies. Some special notes to be aware of. Typically, it is possible in the very first couple of weeks of infection to have a false negative test for Lyme disease, meaning you actually have Lyme disease, but the tests are negative. The sensitivity goes up and is actually pretty good once you reach 4 to 6 weeks after the infection. Another important thing to note is once you've had Lyme disease once, your antibodies may stay positive for months to years after an infection. So once you've had it one time, testing many years later, it can be a little bit challenging to tell the difference between a past infection in a new infection because your antibodies can stay present for many months to years after an infection. Treatment for Lyme disease currently, the recommendation is those who are greater than 8, we typically use an antibiotic called doxycycline. And for those who are younger than 8, we typically use an antibiotic called amoxicillin. And the treatment is for 14 to 21 days, depending on your symptoms. So because that's such a long course of antibiotics, it's nice to be able to have an option for prophylaxis or preventing Lyme disease. So the IDSA has provided us guidelines for tick prophylaxis, and those include a tick that has been attached for at least 36 hours, and the patient presents within 72 hours of that tick bite or tick removal, that the tick is a black-legged tick, and that you are in a Lyme endemic area like New Jersey. The recommendations are for those who are 8 years and up to receive a single dose of doxycycline. Unfortunately, there are currently no guidelines for children less than 8. But for those 8 and up who meet those criteria, we can use a single dose of an antibiotic to potentially prevent the infection. So besides prophylaxis, what are some of the other options for prevention of Lyme disease? The best prevention is really, again, daily tick checks when you're in an area where you might be at high risk for tick bites. And the preventative measures we talked about in our previous episode on mosquito and insect bites. So that would be wearing DEET, at least 35%, and protective clothing. So you really want to make sure the clothing is protecting your ankles and legs, that you have as much of your skin covered as possible. The areas of your skin that are not covered, that you're applying that 35% DEET, and that you're doing a tick check when you return home. Again, you can reference our previous episode for more details on insect bite prevention, but I do want to note that the American Academy of Pediatrics recommends DEET less than 30% for children, and for children under 2 years to not use any DEET at all. So for those children, really the best protection is going to be protective clothing and regular tick checks. So I just want to recap some of the key discussions from today's episode. So Lyme disease is a bacterial infection that can be transmitted from white-footed mice to human by black-legged ticks. Only ticks who are in the lymphal stage are able to spread the disease. The tick must be attached for at least 36 hours to do so. When removing a tick, the best method is to use a tweezer. And if you have a tick or found a tick on yourself or your child, save the tick, bring it to your healthcare provider for inspection. And your child, if they are greater than 8 years of age and have had the tick attached for 36 hours, present within 72 hours after a tick bite, and you are living in an endemic area, they might be a candidate for Lyme's prophylaxis to prevent Lyme disease infection. I hope that you find today's episode interesting and helpful. If you have any comments or questions, please leave them below.
Thank you for watching the BeeHive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.